assuming you have to do a physical exam as part of your nursing assessment on a patient or a client, what are the things are you likely to see? What things are you likely to see so far as your physical exam is concerned? What are some of the things you are likely to see so far as your physical exam is concerned? Can you let me know when you are trying to examine a patient with all that we've learned? When you're trying to examine a patient with hyperthyroidism, what are you likely to see? Just tremors, beautiful. What else? Restlessness, beautiful. What else? When you're checking the vitals, the temperature, is it likely to be high or low? Remember that in the patient, high temperature, yes, because remember that in a patient with hyperthyroidism, they have increased, metabolic rate, right? So the temperature is likely to be high. What about the pulse rate? Will the pulse rate be high, normal, or low?
High.
High, beautiful. What about the blood pressure? Will it be high, normal, or low?
High.
Beautiful. What about the BMI? BMI, the weight. Is the patient likely to be obese or thin?
Thin.
Weight loss.
Beautiful. What about the respiratory rate? Respiratory rate.
High.
Look at that. So even before I even roll my slides, you already know that heart rate will be high, blood pressure will be high, temperature is likely to be a bit high, and that's awesome. Remember that we talked about this patient with the bulging eyes, the bulging eye. So if the thyroid gland, because we know that the thyroid gland is the neck, if it becomes big, and then the patient develops this kind of eye, usually there's a particular cause of high thyroid gland level. We call that Graves' disease. So if you see a patient or a client whose eyes are bulging out like that, and they have thyroid disease, then it is likely that they have Graves' disease. Okay? Graves' disease. Now, if you do your laboratory investigations, the question is, what will you see? Remember we talked about the TRH, TSH, and free T3 and T4. So, in a patient with hyperthyroidism, thyroid glands, thyroid hormones are high. The T3 and T4 will be high. Please write it down. T3, T4 will be high. T3, T4 will be high. Let me say it again. T3, T4 will be high. The TSH will be low. TSH will be low because of that negative feedback we're talking about. And at times we have what we call a radioisotope scan. It's not something you have to worry your head about so much. But then you realize that there's increased uptake of radioisotopes by the thyroid gland. So remember these three things. Free T3 will be high, T4 will be high, and TSH will be low. TSH will be low, free T3 will be high, free T4 will be high. Okay, good.